As a chiropractor in California, and actually in general in the United States, one of the biggest questions I get as a chiropractor is, Doc, can my increase in weight cause my pain? And the short answer is yes, it can actually increase more pain as the more weight you actually gain. And so in America, we have a huge population that is either overweight or obese. In fact, 1 out of 3 Americans are what we consider overweight. More concerning is 2 out of 5 Americans are what we consider obese. Now this is considered based off of what you call the BMI metric, which is based off your height and your weight. Now this is not 100% accurate, just because if you have a short bodybuilder who's like 5 foot but 200 pounds, he's going to be considered obese. But that's not necessarily true. And then you have someone that's skinnier, but they're maybe unhealthy, and that's not going to be a really good indication of someone that's a healthy individual. So we take that with a grain of salt. However, the reality is we have too many people who are overweight and too many people who are obese in our country. In fact, from the worldobesity.org, they say out of 200 countries, America is ranked number 10. So it is a big concern, and because of that, we are starting to see more and more people suffer from chronic pain due to weight gain. And so I want to go over 3 major reasons why obesity can be leading to your chronic pain. If you don't know who I am, I'm Dr. Robert Rosas with Ahava Chiropractic, and I get tons of patients in our office who have different questions, and I make these videos for them. And so hopefully somewhere out there in the internet world, you guys will benefit from this information as well. So let's jump right into the content. So the first reason why you can experience chronic pain from obesity is obesity increases the strain on the joints. Now, what I mean by that? So if you have an individual and they have a spine, what happens is that the obesity or increase in weight is going to increase the axial load onto the spine and onto the joints. And we're not just talking about the spine, we're talking about hips, knees, ankles. Pretty much every joint in the body is going to be affected by the increase in weight. Now, specifically speaking to the spine, you will have the vertebra and then you have the disc in between. The disc have what you call annular fibers or Sharpie fibers, and you have a nucleus in the center of them. Looking at it from the side, you actually have the vertebra here, here, and then the disc in between. Now you have these joints here. This is called the spinous process with the facets. And in between that, you have the nerve, and that comes out here. Now, when you have an increase in axial load, that's going to put weight onto the joint, and then you're going to have a transverse load going outwards this way towards the disc, okay? Now, when you start to strain the joint because of increase in weight, that does not necessarily lead to pain. However, many individuals, whether they're obese or not, suffer different traumas and injuries in their life. Over time, you will develop either bad posture, you may suffer from poor ergonomics, or you just might suffer from different traumas or accidents. So things like car accidents, trips, falls, a bunch of different things can happen. And what happens is when you suffer from these things, you will start making little tiny tears within the fibers of the joint. And when that happens, the nucleus will start to migrate toward the area of weakest resistance, which oftentimes happens in the posterior or the back side of the joint. So that nucleus in the center will start to push towards the area where that nerve is. Now, when you damage the joint, you're going to get inflammation, you're going to get swelling, and you're going to get more pressure where that joint is and where that nerve is coming out of. And that will lead to the pain or the discomfort that you're experiencing. Now, I'm concerned about your pain. However, these nerves don't just go to your back muscles and different things like that, but they go to every single cell, tissue, and organ. So a lot of times we'll start seeing digestive issues, bladder issues, reproductive issues, heart, lung, different things like that, because you're getting irritation to that nerve, and that can lead to an assortment of different health issues here. And so this is one of the biggest things that we want to address, and this is why obesity, when you have problems, can start to lead to strain, leading to disc bulges, disc herniations, and stress onto the joint and onto the nerve here. Okay, so let's go to the second reason why obesity can cause pain. Inflammation occurs when you have increase in adipose tissue. Now, as we start to gain more and more weight, if it's not from muscle, it's usually because you're gaining more adipose or fat tissue. And so adipose tissue is broken down into 2 major cell types. You have what's called brown adipose tissue, and then you have white adipose tissue. Now, brown adipose tissue is known as the good fat, and then the white adipose tissue is known as the bad fat. Now, those cells are two very different types of cells, but when you look at the cell breakdown, in brown adipose tissue, you have the nucleus, and then you have a bunch of little things inside the cell called mitochondria, which helps to create energy, and then you have little triglycerides inside there. Now, this helps with what's called non-shivering thermogenesis. So your body wants to maintain a certain level of temperature, but when you experience cold, then your body will kick into the non-shivering thermogenesis. So think of it like the heater in your body. When it gets to a certain temperature, your body will start to kick in the heater and it will get you back to the temperature that it wants to do. Now, on the opposite side, you have what's called white adipose tissue. And this is a very different breakup. You have the nucleus, you have a little bit of a mitochondria, and you have this big old triglyceride cell in there. And so that's going to be a very different function here. Now, what happens is this: when you start to increase in weight, you start developing less bad adipose tissue, and you start to develop more and more white adipose tissue. Now, as you start to increase more and more weight, what happens is you start to get more and more lipids, and that's going to lead to what's called lipid overload. When that happens, that cell gets bigger and bigger and bigger until it reaches its critical size, and then eventually it will burst and explode, and that cell dies. Now, when that happens, you will get an inflammatory response. So you get cytokines, these proteins called cytokines, and you get these macrophages that are trying to address and take care of the dead cells within the body. Now, that's a good thing, but when it's a chronic issue, you're going to start to develop a lower level of chronic inflammation. Now, inflammation, when you have chronic inflammation, it will lead to what's called a metabolic syndrome. Now, what that is, it will lead to a cluster of conditions that will lead to things like cardiovascular disease. It will lead to insulin resistance. And it will also lead to type 2 diabetes. Now, on top of that, with an increase in inflammation, you will also get an increase in pain. So, an increase in fat, an increase in adipose tissue chronically will actually lead to more issues than just pain. However, in our video, and what we're talking about is why obesity can lead to chronic pain, but it will lead to other health conditions as well. This is why it's very important to take care of this problem. Now, the third reason why obesity can lead to chronic pain is what we call the obesity cycle. Now, a lot of times people will begin to gain weight is because they're eating too much food, but they are becoming less active. So inactivity will lead to an increase in weight. It will also lead to feeling fatigue and lethargic, because as you increase your weight gain, what happens is your muscles now have to carry much more weight, and that's going to require more energy. So as that happens, your energy levels will start to be taken up, and you start to feel more and more tired, lethargic, and fatigued. Now, as you increase the weight, like we talked about, it increases the stress onto the joints, and that can start to lead to an increase in arthritis and an increase in pain. Now, what happens when all of this stuff starts to occur? You increase your weight, you start to feel fatigue, tired, you start to feel pain. Do you think you're going to want to increase your activity or decrease it? No, we're going to start to decrease our activity, and it leads to more inactivity. Now, what happens is this. Now, a lot of patients, they will start to experience less activity and they want to start moving more, but they find that they're having too much pain. And so what do? They go to their doctors. And when their doctor sees them and they say, well, doc, I want to get out of pain. And the doctor looks at them and says, hey, well, maybe if you lost some weight, you can lose some pain or get rid of the pain. Now, as much as that is true, unfortunately, that's not going to solve the problem. And because of that, it creates more and more frustration, as well as because people can't do things, they're dependent on more people, that creates more frustration as well. So that cycle will lead to people experiencing things like depression, anxiety, and unfortunately, with this, if it's chronic, you're going to develop more chronic health conditions, things like heart disease, as well as type 2 diabetes, and guess what? You're going to experience more pain. Now this vicious cycle where you're starting to feel depressed, anxious, you're starting to feel more pain, different health conditions, that's going to lead to a further level of inactivity. And so this vicious cycle will continue that cycle, and this is where people start to gain more and more weight. They start feeling more levels of depression, anxiety, health conditions, and it will lead to less activity again, which will continue that cycle and create this thing called obesity cycle, okay? So what do we got to do about it? This is great, Doc. I really love the information. This is helpful for me to know, but what do I do about it? That's the bigger question. So let's address that and see what we can do. The three things that we can do. The first thing that we can do to overcome this obesity cycle, this obesity problem, the first thing is move more, eat less. Now, we just talked about that. Doc, I'm in pain. I can't exercise. I can't do much. So then what do? The first thing is you want to start moving whatever it is that you can move. If you're sitting on the couch and all you can do is move your arms and start moving whatever you're able to, start exercising however you can, that's burning more calories, and that's what our goal is. We want to burn more calories, but then we also want to eat less calories. If you do those two things, you burn more calories, you eat less calories, what you're going to start to do is you're going to decrease your weight. And that's the goal. Just getting some form of movement is the goal here. If you're just going to move your arms in the couch, or when you're sitting, just do some form of exercise, because you're going to start to burn more calories. If you're able to do where you're in the couch and you're just able to extend your legs, and if you're able to extend your legs, just do it nice and slow and methodical with contracting of the muscles, and that's going to start to stimulate your muscles and burn more calories that way. It's also helpful because when you start to do movement in the joints, your joints need movement to be healthy. We always say that motion is like lotion to the spine. The more movement you have, the better lubricated those joints become. So movement is going to be helpful for burning calories, but it's also going to be helpful for your joints as well. So that's the first step. You want to move more and eat less calories. Now the second thing is you want to eat less, but you want to eat healthier food. So eat better. So eat less, but eat better. Now, what do I mean by that? Most people in America have a high level of consumption of processed foods. Either processed food, junk food, fast food, and we're eating less in terms of nutrient-dense food. So you want to eat less processed food, but you want to increase your nutrient-dense foods. Okay, so let's talk about this, because processed food looks like what? Take, for example, white bread, right? White bread is very processed, and so there's very little nutrients within there anyways. And so what happens is when you eat white bread, it has a glycemic index of 100. What that means, 100 is the highest level of the glycemic index, which is essentially the same as if you had glucose and you take a spoonful of glucose and you consume it and it spikes up your blood sugar levels. The same thing happens when you eat white bread. You're going to eat that thing and you don't even have to digest it very much. Your body just absorbs it pretty quickly and it spikes up your blood sugar levels, which creates a lot of stress within your body. There's a lot of different processed foods like white tortillas, white rice, white bread. All that stuff is processed and it's going to do a lot more damage to our body because there's no nutrients and just spikes up your blood sugar levels and creates a lot more stress inside the body. Now, opposed to that, if you eat more nutrient-dense food, for example, you want to eat whole grain, not whole wheat, but whole grain bread, that has a glycemic index of 41. What that means is your body actually has to work harder to digest it, to break it down, to absorb the nutrients, and that will actually, instead of spiking your blood sugar levels, it will slowly, gradually increase it. So instead of having a huge sugar spike, your body's going to have a sustained level of energy over a longer period of time. On top of that, there's nutrients within it that your body will use to actually function better and become healthier. And so it's much more different compared to processed food because you're going to have more nutrients. It's not going to spike up your blood sugar levels. It's going to create less stress within your body. And so you want to eat less, but you want to eat better. Okay? So the last thing you want to start doing is, the number 3, is you want to seek help. All right. So what do I mean by that? So when you seek help, that looks like many different things. A lot of people think, okay, well, the first place I need to look at is I need to get more exercise. Although that is a good benefit to you, oftentimes that's not the first place you need to seek help. Like we talked about, people who suffer from obesity, chronic pain, that's going to come with a level of depression and anxiety. So sometimes the first place you want to look at is therapist or a counselor. They're going to help you to undo all that baggage, some of the post-traumatic stress that you've had. It's also going to help you to improve your level of depression or anxiety or any fear that comes with obesity. This is going to be one of the first steps that you can do, because if you're feeling better about yourself in your mind, then you're going to actually want to do more activity. So sometimes the first place is talking to a therapist, talking to a counselor, talking to the pastor at your church, whatever it is that you can do that's going to help to improve your mindset. So when you start to attack this area of obesity, you're going to actually start with the right foot. Okay, so that's the first place. Now the second place, now what I would say, is a personal trainer. Now a personal trainer is going to look at you and see what you're actually capable of doing. Based on that, what they will do, because a lot of people are fearful of exercise because it's new to them, they will help to create an exercise workout plan that's catered to your specific needs to help you to burn more calories. They also can help you with nutrition. However, the third step, what I would recommend, is a nutritionist. Now, a nutritionist is going to be somewhat similar to a personal trainer, but they're going to create a meal plan that you can actually eat on a day-to-day basis that's going to help you to lose weight because you're eating less calories, but you're increasing the nutrients within those foods as well. So a personal trainer is going to help you to lose weight by burning calories, but a nutritionist will help you to know what to eat, but also provide that education and support that's needed to continue with that diet. Okay, now the last step, that's number 4. The last step, what I would suggest, is a chiropractor. Now, I am obviously biased to this step because I am a chiropractor, but this is a huge thing. A lot of patients that come into the office are like, "Doc, I want to start exercising, I want to start moving, but I'm in too much pain to actually do that." So oftentimes, like we talked about, when you increase the weight on your joints, those joints are already damaged because there's something that's shifted in the position, whether it be because of your bad posture, whether it be because of trauma that you had from a car accident, a trip, or a fall. And so what happens is, if we don't correct the joint in your body, all that inflammation and that damage to that joint is going to keep causing more pain. So if we can recorrect the positioning of that joint, your body's going to start feeling better, so you can start to be more active as well. And that's how we break that obesity cycle, because you increase your activity level, you start to lose weight, you start to decrease your pain, and you start to become more active, and then your mood will start to improve as well. So instead of having that obesity cycle, now you're having a health cycle instead. And so that's what you want to continue to do. If you do those 3 things, that's going to really help you to end the obesity cycle, reduce your weight, start feeling better, start feeling more energy, improve your mood. There's so many benefits from that. And that's it. Thank you so much for watching. If you like this video, please click that like button. If you want to know more information about our office and some health information that we're going to be giving, please subscribe to our channel. If you have any questions about the obesity cycle and some things that we talked about, please leave those comments below. But thank you so much for being here. We appreciate you. Have a good day. God bless. Peace.